All right, there's new evidence of the growing mental health crisis impacting our kids.
A recent analysis shows the surge in ER visits for psychiatric concerns during the pandemic was driven largely by young girls ages 13 to 17.
So here with some insight is Dr. Khadijah Booth Watkins. She's a child psychiatrist and the co-director of the Clay Center for Young Healthy Minds at MGH. Dr. Booth Watkins, thanks for your time.
Thanks for having me back.
So does it surprise you that that group, young girls, ages 13 to 17, was impacted so strongly?
Yes and no. I mean, at this point, we all know that we're in the middle of a mental health crisis for our young people. And so boys and girls are both utilizing the emergency rooms at high rates. But it's not surprising if we recall that the social media had a more negative impact on our girls, and also the role that stigma may be playing here. You know, girls are more often likely to talk about their struggles and distresses and ask for help. Whereas for boys, because of the stigma, they may be less likely to talk about it and less likely to ask for help because they might see it as weakness or might be afraid that their peers or family members might see it as a weakness. So there is no real one explanation as to why there's this gap, but there is this gap, and so we do need to understand it more.
What does it tell you, Dr. Booth Watkins, that these young women and their parents, they're going directly to the ER for care?
It tells me a couple of things. It tells me that, I mean, when we think about the emergency room, we use it when we're in crisis, when there's safety issues. And so it tells me that these families are in crisis. These young girls are in crisis, and there may be safety concerns. There may be suicidality, homicidality, there may be self-injury. And so they have to use the emergency room to keep their child safe. But alternatively, if we think about the lack of education as it relates to mental health, often it's not, the signs and symptoms aren't noticed early enough. And so they're left to kind of go on and on until they reach the crisis point. But there are also occasions where families want to get help for their kids, and due to the workforce shortage, they really don't have any other recourse than to go to the emergency room.
Yeah, certainly a shortage of therapists as well. All right, so the survey of insurance claims showed the biggest issues in this surge were suicidal and self-harming behavior and eating disorders. So what should parents be watching for when it comes to these conditions and when it's time to seek help?
I always say look for major changes. So major changes in their mood. Suddenly they're moody, depressed, there's anxiety, they may be more irritable, they're withdrawn, they're isolative. And as it relates to the eating disorders part of it, they might become more compulsive or excessive about exercising. Suddenly they might want to eat alone or in secret. They might begin talking more and be more obsessed about their body image and the body image of others. They may often, vomit after eating or spend long periods of time in the bathroom immediately after meals. And you may also notice marks or scars on, their knuckles or the back of their hands. These are all signs and clues that there's concerns for eating disorders. But again, any major changes in mood and anxiety definitely is of concern. And of course, if there's safety concerns, talk of suicidality, then that's an emergency.
It's so important to pay close attention. Dr. Booth Watkins, thanks as always for joining us.
Thank you.